Hello everybody, my name is Lulu Achua. Today I am going to be conducting a cardiovascular assessment on my patient Miss Amel. And here is my patient Miss Amel. Hi Miss Amel.
Hi.
Today I'm going to be doing your cardiovascular assessment, okay?
Okay.
Okay, so during this assessment I get into my patient's before I get to my patient's room, I have checked my doctor's orders. So when I get into the patient's room, I provide privacy to my patient. I wash my hands and I ask my patients for the two form identifiers. Can you please tell me your first and last name, Ms. Amel?
Okay.
So,
First name is Amel. Last name is Kua.
okay, while she's doing that, I cross check with the armband. Yeah, I'm on the right patient. And can I then I continue with the procedure. um, I have already explained the procedure to the patient. I've already checked my orders. I provided privacy. I wash my hands. I gather my supply, which is just my stethoscope, which is right here, and a watch, which is right here. Okay, Miss Amel, I'm going to be asking you some these questions, so I have to get a little bit of history of your cardiovascular health. So, do you have any symptoms like chest pain? Any
No.
chest pain?
No.
Any shortness of breath?
No.
Do you feel dizzy?
No.
Do you have any fatigue?
Mm,
Any palpitation?
no.
Okay, so my patient is okay at this point. She says no to chest pain, no shortness of breath, no palpitation, no dizziness, no fatigue. And then I am going to be obtaining the patient's heart rate, and I also have to note the rhythm. So I'm going to be assessing her heart rate, noting the rhythm, and a normal heart rate for an adult is between 60 to 100. So, and she is a female, and because of the breasts, I'm sorry to put my hand under you. I'm gonna go right here and account for 1 full minute. I'm sorry, my camera fell off while I am measuring the heart rate. Yeah, she has normal heart rate, and I got 63 beats per minute, and I got the loop doop, which is okay. Next, I'm gonna be inspecting my patient's appearance. I'm looking for any distress, any sinuses, or pallor, and any lower extremity changes in any lower extremities, like the color. So I'm looking at the skin. The skin is the color is skin color is normal for ethnicity, and I can see she's clean, no tags, no pigmentation. Actually, this is not an actual patient. This is my co-worker, so I cannot take off her clothes. I'm sorry. So I'm just gonna be doing the normal assessment, like I check over her skin, no pigmentation, no tags, no tattoos, no stretch marks. I'll check. Can I check your arms? I check the temperature. Just stretch your arm for me, please. Let me check the temperature with the back of my hand. Check the temperature. And I know there is a place where I have to do the lower extremities and the upper extremities. So while I am inspecting her, I just want to use this opportunity to check the temperature, and everything feels normal. I checked your legs. Can you please raise one for me? Check for coloration. Everything is okay. Normal coloration. Okay. Next, I'm gonna be palpating the pulse, the carotid pulse, and with this, I'm doing it one at a time so that I don't strain the muscles or the yeah, don't strain the nerves or the muscles on the. So I do this. While I'm doing this, I'm also checking on the noting the rhythm and the force. This is 2 plus. And this is 2 plus as well. Next, still on the neck, I'm gonna be doing my auscultation, and I'm gonna auscultate the for carotid breast. I'm sorry, I can't pronounce the word that well. So I'm gonna be auscultating for carotid breast, and that's gonna be done in 3 places. Um, I'm going to be using the bell of my stethoscope. While doing that, I note the rate, the rhythm, and any abnormal sound. So I'm also going to ask my patient to take it to take a to breathe in and out while I do it, and I do that fast so that I don't get any breath sounds. Can you breathe in for me, please? Out. Out. Okay, no more breathing. Okay, in, out. Okay, in, out. Okay. Next, I'm going to be working on the chest of the patient. I'm going to be assessing the patient's chest, and by so doing, I'm going to be palpating the apical impulse. I'm going to be palpating on the 4th and 5th intercostal space, intercostal space, and on the norm, my patient was to be on a bed, but since this is not an actual patient, it's my co-worker, and I don't have any bed around for her to lie on, I'm just going to be demonstrating that while she's sitting on the chair, and my chair cannot recline as well, so we're just going to do the demonstration. So I'm checking for the 4th and 5th intercostal space, which is at the mid clavicular line. So I'll check from the first to get the right spot. First intercostal, second, the third, the 4th, the 5th. So the clavicular line, I get it from here, and this is the midpoint. So this is where I am working on. So at this point as well, I'm going to be auscultating on the rhythm and checking for any abnormal sound. I'm going to do the aortic, pulmonic, tricuspid, and the mitral. Aortic, the pulmonic, Erb's point, tricuspid, the mitral, okay. So I did the first one with the bell of the stethoscope, so now I'm going to do with the diaphragm of the stethoscope. So we start again. Listening to the full heart sound from the aortic, pulmonic, the herbs, tricuspid. Sorry, because it's a female, I have to raise the breast up a little bit. For the mitral. Next, I'm gonna be working on the upper extremities of my patient, the hands and the limbs, upper limbs. So I'm gonna be palpating the radial pulse bilaterally. Oh, right there. There you go. And I'll do that. Accounts for 30 seconds and multiply it. The patient has it's a +3. The next, I'm going to assess the capillary refill in both, and I'm going to do that bilaterally. Less than 2 seconds. 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 So the capillary refill is it refills in less than 2 seconds on both bilaterally. Next, I'm going to move to the lower extremities, and first I'm going to be checking and palpating for the femoral pulse, which is located at the crest of the groin, and then I'm going to move to palpate the popliteal pulse, which is behind the knees. So I'm sorry, my camera cannot really go down there, so I'm palpating the popliteal pulse behind the knees bilaterally, and that is 3+. And the next, I'm gonna be doing capillary refill on the lower extremities. I'll press the knee bed for 5 seconds and on each, and watch how it refills. So I'm doing that. So the capillary refill is less than 2 seconds. So while on the lower extremities as well, I am assessing for edema. There is no pitting on road bilaterally. No edema located. And so that is +1, which it is mild because it filled up immediately. So it's a +1. And now we have come to the end of the assessment. I am just going to document my findings. Any findings abnormal, or any changes, any discoloration or anything abnormal, or whatever findings I get, I have to document it so that everything be in writing, and the next nurse is going to know what was done and where to continue from. Thank you for watching. So after this, at this point, I'm going to take off my gloves if I had one on, and wash my hands, and I thank my patient. Thank you, Miss Amel, for your patience and your time, and I'm going to leave the room right now. Bye.